The Department of Education recently made one of the dumbest decisions ever regarding healthcare. They decided that nurses, nurse practitioners, physician assistants, occupational therapists, and physical therapists, among others, are no longer considered professional degrees. Not only is this extremely insulting to some of the most integral healthcare providers that we have, but will also likely impact staffing of these types of practitioners. We're currently facing an extreme nursing shortage, and it's only going to get worse over the next several years. Now, there are a lot of reasons for this, but one big one is burnout. Surveys show that 4 in 5 nurses face extreme stress while at work. And this has only been made worse after the pandemic, where you get stupid people who don't respect them and will even assault nurses. And staffing shortages, partly caused by poor reimbursements from insurance companies to hospitals, cause these nurses to have to handle many more patients than they can safely handle. Now, on top of that, the Department of Education, headed by former WWE executive Linda McMahon, is now calling them no longer professionals. And this will limit the amount of federal student loans that nursing students can take out. Now, this can't make the nursing shortage worse, could it? Now, the fact is that nurses are the most important part of the hospital system. Yes, even more important than physicians. If all the nurses were to quit their job today, the hospital system and healthcare would fall apart literally within minutes. But if you think about it, if all the doctors would quit today, then nurses can actually keep this shit going for a while. And then you take physical therapists, all of them whom now are required to get a doctorate in physical therapy to practice. They too will be limited in the federal student loans that they can take, so that they literally will not be able to actually pay for schooling. I think Linda McMahon may have had too many DDTs and stone cold stunners that she has lost her freaking mind.
Hey everyone, welcome back to the channel. If you're new here, go ahead and hit that subscribe button, give this video a thumbs up, and turn on those notifications so you never miss a breakdown of the latest political roller coaster reshaping America. Now buckle up, because today's story, it's not only unbelievable, it's downright insulting to millions of hardworking Americans. Now, the Trump administration has officially downgraded nursing, by having the Department of Education classify it as no longer a professional degree. You had that right. Now, a whole field built on science, precision, public health, and literally saving lives has apparently been demoted. So the question is, why would any administration disrespect an entire workforce that keeps hospitals running, saves lives around the clock, and carried America through a pandemic?
So the Department of Education announced that nursing is no longer considered a professional degree, which is kind of ironic considering that the people who are making these decisions are old people who are soon to be going to be screaming for their nurse to change their bedpan. But I digress, and as someone who's a nurse, I want to go over some things that make nursing very unprofessional, because it makes a lot of sense. Number one, as nurses, we save lives, and that is so overrated. Like, who cares anymore that you dedicate your entire career to saving people's lives? It's not like if we all quit our jobs, the entire healthcare system wouldn't collapse on itself, because it definitely would. And number two, we don't just save people's lives, we keep people alive. But I saw on the list that they considered chiropractics professional, but not nursing. So honestly, in the ICU, just fire all of those ICU nurses. They're just a waste of money. Just put chiropractors in there and just have them adjust every patient. And then all of a sudden, I bet they'll get better patient outcomes than whatever we could do,
By now, you've probably seen that the Department of Education has updated its definition of professional degree programs, and different degrees like OT, PT, and nursing were not included. But before the rumors start running your stress levels up, here's the real unbiased truth. As a nurse, I want to talk specifically about the nursing profession. This change wasn't about devaluing nursing, and it wasn't about limiting your future. It's part of the routine update to make federal program categories cleaner and more consistent. Nursing simply has too many pathways, ADN, BSN, MSN, DNP, to fit neatly into the narrow category that they were defining. Nothing about your licensure, scope, salary potential, or career trajectory changes. One side effect of this update is that nursing students may no longer qualify for the highest loan limits reserved for MD, PharmD style programs. And that can sound scary, but it doesn't have to be. Lower loan limits means you're less likely to take on unnecessary long-term debt for a degree that was never meant to cost $200K. You're still becoming a registered nurse. You're still joining one of the most respected and essential professions in healthcare. You're just being financially protected from predatory lending structures that don't match the way nursing education works. I think the most important thing to understand is that this wasn't done to hurt you. It wasn't done to downgrade nursing. It wasn't done to send a message. It was administrative housekeeping, and the unintended result might actually be better financial protection for future nurses. You're still entering a profession that saves lives, leads teams, and drives the entire healthcare system. None of that changes. I know this video will rub some people the wrong way, and honestly, for me, I was offended at first too, but after stepping back, I'm trying my best to look at what the Department of Education has changed with an unbiased perspective. If you see it differently, I would honestly, genuinely love to have a respectful conversation about it.
Nurses and teachers are no longer considered professionals, according to Trump's Department of Education, along with physician assistants, physical therapists, nurse practitioners, audiologists, architects, accountants, other education degrees, social workers, other mental health degrees, and a number of other healthcare professions. And this is all to drive people towards private student loans. Because without that professional classification, well, it caps the amount of federal student aid that one can receive from the government at $20,500. If you have that professional classification, well, that's now capped at $50,000. Professional classifications include doctors and lawyers. Degrees that routinely cost $200,000, $300,000, $400,000, $500,000 are capped at $50,000 in federal student aid. The other ones are between $40,000 and $80,000 routinely, and is now capped at $20,000. This is all to drive individuals towards those predatory private student loan companies ran by private equity firms. So while the government's going to make all of us that may be pursuing an advanced degree or a degree in general poorer, they're doing so to enrich companies that are already worth billions and billions of dollars.
What's funny is I thought that I was about to go to school to be a nurse practitioner, but I don't think so at this point because they said nursing is no longer considered a professional degree. I'd like to see these people go to school for 2 years and get associates. I'd like them to go to school for 4 years and get a bachelor's. How about they go to school for 6 years and get a master's and see how professional that is? Just graduated school. I'm a new grad resident. I had a dream that I was going to be a nurse practitioner. I planned on going next year. But guess what? In 2026, they said that they're cutting the funding. Y'all not getting no more loans, baby. Well, y'all are. But guess what? Y'all only get $20,000 a year. The school I plan on attending is $60,000. To get a master's degree in nursing and science, to become a psychiatric nurse practitioner, $60,000. They're only going to give us $20,000 a year. You do the math. The program's 2 years. $60,000. They're giving me $20,000 a year. That's $40K. Guess what? I got 20 grand I still got to come up with. That means I'm not going to school. Who's coming out of pocket $20,000 just to go to school? When I'm used to getting grants and loans and things of that nature. But now they said no. Figure it out. They don't want us to continue our education. They want us to stay exactly where we at. They want the women to be barefoot and pregnant because nursing is primarily dominated by women. They said nah. Y'all go ahead, get back in the kitchen, make me some food, and take care of my children. That's what they want you to do. They don't want you to advance. They don't want you to make more money. They want to see where you at. Crabs in a bucket. But you know what? I ain't gonna worry about that. I'm gonna take my talents elsewhere. Y'all better work on y'all businesses. Y'all better get y'all LLC. Y'all better do what y'all need to do. Y'all need to get y'all social media following up. Y'all better collect the bag another way. Because I don't know if you're going to get this other degree. I would like to, but I don't know. They're playing with my top. But it's all right. I'll call you back. Bye.
A lot of people are confused and spreading a lot of misinformation, having a lot of back and forth about what exactly is going on with nurses no longer being considered a professional degree, including a lot of articles on the internet. So I'm going to clear it up for you right now. When the One Big Beautiful Bill Act got passed, what it did was change our federal student loan system. So previously, up until this goes into effect on July 1st of 2026, people who are currently in graduate school, for medical school, physical therapy school, whatever kind of graduate school it is, you could take out as many student loans were required to pay for your graduate schooling. There was no cap on it. The One Big Beautiful Bill Act changed it so that we would now have a two-tiered system. People who were considered professional degrees could now receive a lifetime student loan limit between undergrad and graduate school from the federal government of $200,000 and up to $50,000 per year for their graduate training. People who are in graduate degree programs, which have a different definition than professional programs, and I'm going to read you that definition in just a second. People in graduate programs have a much lower lifetime limit, only $100,000 and $20,500 per year. So this is what the big change is, and this is what I need you all to really lock into and pay attention to, because it's not permanent yet. It hasn't happened yet. Okay, so this is the original definition of a professional degree, which we were working with up until the proposed change. This is a screenshot from the summer when I made a video about this. Okay, so a professional degree requires both completion of the academic requirements for beginning practice in a given profession, and a level of professional skill beyond that normally required for a bachelor's degree. Professional licensure is also generally required. Examples of a professional degree include, but are not limited to, remember that language, are not limited to, pharmacy, dentistry, veterinary medicine, chiropractic, law, medicine, optometry, osteopathic medicine, podiatry, and theology. Under this definition, the majority of healthcare professionals getting master's degrees and doctorate degrees, like psychologists, speech and language pathologists, like CRNAs, like nurse practitioners, nurse midwives, and so on, we would all fall under this category, and we should be able to access that higher federal loan limit, which is essential because these degrees are very expensive and required to enter practice. And we need the fair federal loan system in order to make it accessible. This is the proposed definition change that came out in October. It is not a law. It is not a bill. It has not been locked in yet. And this is what's going to hurt healthcare professionals that require master's degrees and doctorate degrees. So the new definition proposed of a professional student: a student enrolled in a program of study that awards a professional degree upon completion of the program. A professional degree is a degree that signifies both completion of the academic requirements. A professional degree is a degree that signifies both completion of the academic requirements for beginning practice in a given profession and a level of professional skill beyond that normally required for a bachelor's degree, where professional licensure is also generally required. And here's the language change that is so scary. The next part of the sentence reads, and includes the following degrees. They took out the phrase, but is not limited to. And includes the following degrees: pharmacy, dentistry, veterinary medicine, chiropractic, law, medicine, optometry, osteopathic medicine, podiatry, or theology. So now, instead of anyone who required a master's degree or doctorate degree to enter practice, that, otherwise would have met the definition of professional degree, and they have some other qualifiers below it that describe the nature of a professional degree, nobody else counts except for these 10 professions. Not psychologists, not CRNAs, not nurse midwives, not practitioners, not speech and language pathologists. Nobody except for these 10, because the goal is to cap the amount of loans that they're giving out entirely. And they're really leaving out so many healthcare professionals that need access to these fair federal loans so that we can afford to enter practice. By not including advanced practice nurses like nurse midwives, nurse practitioners, CRNAs, by not including psychologists, speech and language pathologists, physical therapists, occupational therapists, and so on in the definition of professional degree, you're going to force people to go to the private market for student loans, just like what people do for undergrad, right? Federal loans have always been capped for undergraduate loans, and it never drove down the cost of tuition. People instead went to the private market, but those loans have higher interest rates and they're more predatory. And we all know that graduate school is even more expensive, right? Even more years of education. In order to get these loans in the first place, people are going to be required to have higher credit scores and have a cosigner in most cases, which is kind of crazy if you're an adult learner. But this disproportionately hurts people who come from low income backgrounds and who might be first generation Americans, because they might not have someone to co-sign with them. Okay, so this is not going to do anything to stem the rising cost of tuition. All it's going to do is ensure the graduate education is for the wealthy. Tying it all in a little bow, One Big Beautiful Bill Act got passed. Anyone who takes out their first set of graduate school loans after July 1st of 2026 is now going to have to be defined as either a professional student or a graduate student, right? Professional students get $200,000 lifetime annual limit, $50K per year. Graduate students get $100,000 lifetime limit, $20,500 a year. Most people will now fall under the category of graduate student if this new definition passes. This new definition is not a law, it's not a bill, it is a proposed definition change from within the Department of Education. Things we can do to act on it are to contact the Department of Education directly, or if you have a senator or representative who sits on one of the boards that oversee the Department of Education, you have an opportunity to speak to them, to encourage them to influence the DOE to not go through with this new proposed definition change. Soon, there will be a public comment period open where all of us can comment on it. So I'm going to be keeping an eye out for that. And as soon as it opens up, I will let you know. So please stay tuned for more. But let's please also be very, very clear on what's happening so we can get our definitions straight. No one has stripped away nursing from being a professional degree. Nursing is not a graduate degree. Nursing was never really affected by this at all. It does, however, disproportionately affect advanced practice nurses, such as CRNAs, such as nurse midwives, such as nurse practitioners, who are crucial for delivering healthcare all across this country. It also disproportionately affects other healthcare professionals like physical therapists, occupational therapists, psychologists, and more. So we do need to be vigilant about this. We do need to stay on top of it, and we do need to act before this change goes into effect.
Nurses are no longer labeled or recognized under the Department of Education as a professional degree, and this includes nurse practitioners. The biggest impact is the federal student loan amount that you'll be able to receive. So if you're an RN, for instance, and you wanted to move on to get your master's degree, you no longer can borrow more than $20,000 a year in federal student loans because you are not labeled as a professional. The cap on which you can borrow is $20,000 a year. An average nurse practitioner program is looking at $30,000 a year. So that means you have to have $10,000 out of pocket in cash or a private loan to cover the rest of your tuition. What I'm getting from this is the United States is making it incredibly difficult for the average American to get an education, a good professional education. I feel like this is all deeper than what it appears to be at surface level. It almost seems like we only want the wealthy to be educated.
I'm gonna need the Department of Education to find something else to do. Find another career or to mess with. Leave us nurses alone, okay? I got an opinion about this. So if you guys don't know, I'm a nurse practitioner. I do possess my Doctor of Nursing Practice degree, DNP. And it's really unfortunate that the Department of Education is proposing the new definition of a professional degree program. Nursing is going to be left out. But like medicine, dentistry, I think even chiropractors, pharmacy, law is going to be included. So this means that if nursing is not included, certain advanced nursing programs will be left out when it comes to funding, like federal loans and student aid benefits. That means it's going to be affecting DNP programs, advanced practice nurse programs, nursing leadership, MSN to PhD pathways, and literally like the future of the nursing pipeline, pretty much. And for me personally, when I was doing my MSN to DNP program, I needed that loan money to survive. Mind you, I worked part-time, but I needed that extra funding from my loan to pay my tuition and to also to fund my life and to get through and survive school. Because if you ever done that program, y'all already know that the weak won't survive. I was almost deemed weak, okay? Because I had 2 semesters left of my DNP and I sure enough was this close from dropping out if it wasn't the sake of my mother begging me not to drop out. But I say all of that to say, how dare they? Blood, sweat, and tears. This is a very prestigious, respectable profession that people work extremely hard for. I literally dedicated a lot of my life to finish school. I literally started from CNA all the way to DNP. So majority of my life was always doing some work, but always focusing in school so I can be done. You know what I mean? Just to look back and know that people who want to take the same route as me may choose not to take that route, or it's going to be harder to support their life and to pay their tuition. It's going to make grad school more expensive, like it's not already expensive. It discourages future nurses, to wanting to pursue an advanced degree, undermines our professional standing, which is very disrespectful. Definitely going to worsen provider shortages, which is already a bitch. And it sends the wrong message about the value of nursing. Like, why do y'all hate nurses so much? Like, I don't get it. So I just say all that. I'm just sending love to the nursing community, people who do have these advanced degrees. It's been a lot of ruckus lately and sharing opinions with colleagues of mine and friends of mine, and it's really disheartening, and it gives out the wrong message. We do bring value, and we literally are the heart of the healthcare industry for a lot of things. Before you see a doctor, you're more than likely going to see a nurse practitioner. A lot of your professors at school are going to be nurse practitioners. Most of them will have Doctor of Nursing practice degrees. So it's just sad to see how hard people work in this field, and to get to this prestigious level just for it to be ripped away, and for them to discourage the future of people who are in these programs or want to be in these programs. So, like, we can't let the government devalue our profession. Sending love out there. Stay educated, stay aware, and just know that you matter. So, I don't know. I just had to get that off real quick. They never going to demote me and what I got, because I worked hard for it, and I'll be damned.
So let's break it down. What happened exactly is that the Department of Education under Trump administration issued new classification guidance that removes nursing from the professional degree category, the same category shared by fields like medicine, law, engineering, and pharmacy. Now, professional degrees are usually tied to high-level scientific training, licensing requirements, professional boards, rigorous academic expectations, critical public service functions. But suddenly, nursing, a field requiring all of the above, is being kicked out of that group. It's not just symbolic. This classification influences federal statistics, institutional funding, academic program development, international recognition of credentials, workforce public discussions, and in some cases, even how other countries evaluate US nursing qualifications. So, what's the rationale? Now, there are a few possible expectations, non-flattering. One being budget politics and workforce cost cutting. Now, when you downgrade a field, you can justify reducing federal grants, educational support, development funding, scholarship programs, compensation-related analysis. Keeping nursing classified as a professional degree requires investment. Downgrading it, now the government can treat it as a technical or general field, easier to slash, easier to overlook, easier to undervalue. Now, two being the immigration politics. Nursing is one of the largest fields for skilled immigration visas. By downgrading its classification, the Trump administration may be attempting to restrict the number of international nurses entering the US, reclassify nurses as low-skilled workers, reduce visa categories available to nursing graduates, change how foreign degrees are evaluated. Now, given past attempts to limit skilled immigration, this aligns with their ideology. But this would come at a cost, because US hospitals already rely heavily on immigrant nurses. Now, three being culture war messaging. Let's be honest, there has been a long-running political push to downplay science-based fields, public health, and institutions that contradict ideological narratives. Nurses who operate strictly within science and evidence-based practice have often publicly contradicted misinformation, especially during crisis. Now, this move looks suspicious, like part of a broader pattern, diminish the credibility of experts, so political rhetoric can replace facts. Now, four being a misunderstanding of the profession. Harsh as it sounds, some policymakers seems to have no real idea what nurses actually do. To them, nursing is helping doctors. To reality, nursing is clinical assessment, diagnostics, pharmacology, care planning, critical thinking, life-saving intervention, independent professional judgment. The downgrade exposes a deep ignorance of one of the most complex and demanding fields in healthcare. What does this mean for nursing going forward? Here's where it gets serious. Now, the reclassification won't change what nurses do, but it affects how the system treats them. One educational institution could be impacted. Universities may face funding shifts, accreditation pressures, changes in program catalog, less leverage to justify program expansion. That could mean fewer spots for future nurses at a time when shortages are already severe. Now, two, being international recognition may suffer. Countries that rely on US classification systems might question the professional status of American nurses. Now, create barriers for nurses working abroad, require additional exams or credentials. Nurses could become less mobile internationally. Now, three, being staffing shortages could get worse. If nurses is publicly downgraded, fewer students may choose to be nurses. Now, if you are choose it, shortage is deepening, and when shortage is deepening, patients suffer. It's a domino effect, and policymakers should know better. Now, four, being the long-term respect and compensation, symbolic disrespect can become a policy reality. If nursing is classified as non-professional, future discussions about pay, staffing ratios, overtime, union rights, workplace protections become easier for politicians to dismiss. You can advocate for professional pay when the government says you're not a professional. But this downgrade is more than bureaucratic wordplay. It's disrespectful, dangerous. It sets a dangerous precedent that undermines the backbone of America's healthcare system. Now, if a government can downgrade nurses today, what profession gets downgraded next? Teachers, scientists, or even engineers. When experts become political, the whole nation becomes weaker. So it raises questions like, do you think this downgrade is political retaliation, cost cutting, or something else entirely? And how should nurses and nursing organizations respond? If you're a nurse, how does this decision make you feel about professions or about the profession's future? What do you think this move will mean for the US healthcare system on a long term? Drop your thoughts in the comments. Let's get these conversations going. Thanks for watching, and don't forget to like, share, and subscribe to the channel to enable us reach larger audience. I'll see you guys on my next video. Credit belongs to original creators.